responsibility
Louder or
to talk about a giant that's conquering the world, what we call diabetes. 500 million people globally, 30 million people in the United States suffer from diabetes. 15 million of them are women. 1 in every 9 adult women, almost approaching the rate of breast cancer. 96 million people in Americans have pre-diabetes. That's 1 in 3. And South Asians like us are 4 times more likely to develop pre-diabetes than general population. So women have a unique set of health challenges, higher risk of developing certain conditions like heart disease, cancer, and diabetes. All these could be potentially prevented or treated if identified early. So before we talk about diabetes, I want to just go over and quickly understand what is diabetes and what happens. So diabetes is a condition in which you have too much glucose in your blood because the body is not able to process glucose properly. Glucose in our bodies comes from 2 sources, what we eat, and your liver is also making some glucose all the time. Now the glucose that you eat is processed in your intestine and it has to go into the circulation, and from there it has to get absorbed into your cells where it's used as energy. And to do this, the glucose requires insulin. So basically insulin is the key that opens the doors for the glucose to enter into the cells. So when you have diabetes, your body is either not making enough insulin or your cells become resistant to the action of insulin. And without properly functioning insulin, the glucose cannot enter into the cells. And therefore the levels of glucose in your blood keeps getting higher and higher. And over time, persistently high glucose will damage these blood vessels and lead to problems like heart issues, kidney disease, vision loss, and amputations that we see with diabetes. So broadly, we classify diabetes into 2 types, type 1 and type 2. This sometimes confuses people. Type 1 is an autoimmune condition, meaning it happens when your body's own immune system attacks your insulin-producing cells in the pancreas. And the insulin-producing cells are destroyed. This includes about 10% of the population. This is diagnosed early in life, although it can occur at any time. I've had patients who are diagnosed with type 1 in their 70s. People with type 1 diabetes don't make any insulin, and therefore they have to be treated with insulin, and that is the reason why it's sometimes called insulin-dependent diabetes. Whereas people with type 2 diabetes, the body is making some insulin. It's just that the insulin is not good quality and it's not working properly. This is the more common type of diabetes. 95% of the people have type 2 diabetes. And there's a big role in environmental factors like having excess weight and physical inactivity, which plays an important role why people get this diabetes. The next is pre-diabetes. Pre-diabetes is a condition where your blood glucose is high, but it's not high enough to be officially diagnosed as diabetes. So this is really your window of opportunity to do something. Because if you make appropriate changes in lifestyle in pre-diabetic stage, you can definitely prevent or at least delay your diabetes by several years. In 1996, NIH did a huge study called Diabetes Prevention Program, where they wanted to see if lifestyle intervention was effective in preventing diabetes. And they found that lifestyle intervention actually played a major role in preventing type 2 diabetes. Losing only 5 to 7% of the body weight would decrease your risk of diabetes by 58%, which was huge. Another form of diabetes is gestational diabetes. This is the kind of diabetes that you develop during pregnancy, usually diagnosed between 24 to 26 weeks of pregnancy. This type of diabetes tends to go away after pregnancy, but these people are at higher risk to develop diabetes in the next 2 to 5 years. So if no intervention is done, again, it gives you an opportunity to make some healthy lifestyle changes and prevent yourself from getting this, but if no intervention is taken, you're likely to develop diabetes in the next 2 to 5 years. And Asian women particularly are also at greater risk for developing gestational diabetes. Can we prevent diabetes? Definitely. So in terms of type 1, there is both type 1 and type 2 diabetes. There is diabetes as genetic inheritance. In type 1, the genetic factor is much stronger, but the environmental factors can help control type 1 diabetes. And if you had asked me, can you prevent type 1 diabetes 2 weeks back, I would have said no. But just 2 weeks back, FDA recently approved a new drug for type 1 diabetes called tacrolimus, which is likely to delay type 1 diabetes by at least 2 to 3 years. And this is like a breakthrough in type 1 diabetes. We have never had a drug like this before. So we are hoping that this will work and it will really be a game changer for people with type 1 diabetes or having family history of type 1 diabetes. Type 2 diabetes is also genetically inherited, but this is only a small part of it. Environmental factors play a much bigger role in development of type 2 diabetes. So what are some of the risk factors? Again, for type 1, having family history, having the autoantibodies, and anything that would injure the pancreas completely so it stops functioning can also cause type 1 diabetes. But type 2, as you can see, the list is much longer. Family history is only a small portion of it, but belonging to certain ethnicities just increases your risk. So being South Asian automatically increases your risk of developing type 2 diabetes. Overweight or obesity, being physically inactive, age is a major factor. As you grow older, your chances of getting diabetes increases. Having prior history of gestational diabetes, having a condition called polycystic ovary syndrome, and prior history of any kind of heart disease or stroke also increases your risk of developing diabetes. So there is why we as South Asians have higher risk of diabetes, because there's differences in fat distribution in Asians and non-Asians. So based on standard BMI chart, you may not be considered overweight and may think you're not at risk. But as a person of Asian descent, you have less muscle and more fat than other groups. And this extra body fat tends to be in your belly, what we call visceral fat. So there's two kinds of fats in the body. One, what we call subcutaneous fat, which is the fat that's under your skin and you can see. Whereas the other kind of fat is the visceral fat that surrounds your organs, like your kidneys, your heart. And a little bit of visceral fat is good because it protects your organs. But when you have too much of this, the risk of developing diabetes and heart disease and stroke significantly increases. And Asians tend to have a lot of visceral fat, and that's the reason why Asians, when they do develop type 2 diabetes, they're not necessarily obese, but they still develop diabetes. So there are some differences in BMI, and it's important to know this because in general we look at the regular BMI chart and we call ourselves or we see ourselves as overweight or obese based off that. But you can see that in South Asians, the BMI cutoff for obesity in general Caucasian population is 30, whereas in South Asians it's 27. And same as this for the overweight, where the BMI cutoff is 29.9, whereas for South Asians is 26.9. So keep in mind when you are evaluating yourself in terms of weight. Another concept that confuses people is insulin resistance. So what does that mean? Insulin resistance is the core problem behind diabetes. So that means that the body cells are less sensitive to insulin. And it develops due to a combination of, again, genetic as well as lifestyle issues. If you have a lack of physical activity, it plays an important role. As during physical activity, your muscles use a glucose to produce energy. When a person is not active, the muscles become resistant to the action of insulin. And insulin resistance is obviously higher in people with a higher amount of body fat, but one can reduce insulin resistance by making healthy lifestyle changes. So how do you diagnose diabetes? Basically, there are two main tests that we use to diagnose diabetes, fasting plasma glucose and A1C. Fasting plasma glucose is the glucose that you check in the morning after fasting overnight, and the cutoffs for that are here. Basically, anything 99 and below is considered normal. 100 to 125 is pre-diabetes, which is where you can intervene and prevent yourself from getting diabetes. And then anything 126 and above is diabetes. Similarly, in terms of A1C, A1C less than 5.6 or less is normal, 5.7 to 6.4 is pre-diabetes, and anything above that, 6.5 and above is diabetes. Oral glucose tolerance test is usually, it can be used, but we don't routinely use it for diagnosis of diabetes in general population. We use that to diagnose gestational diabetes and some other conditions. So, in terms of signs and symptoms, unfortunately, there are no signs and symptoms of diabetes early on. So, when you first get because you can have diabetes for as much as 5 years and you won't know unless you're going for a routine checkup and getting it checked. Because by the time symptoms develop, either your diabetes is uncontrolled or you've already developed complications. But some of the red flags for that is increased thirst, increased urination, feeling hungry, feeling really tired. If you've developed neuropathy, you can have numbness or tingling in your hands or feet. Sometimes it can present as unexpected weight loss, nausea, or vision issues. So management of diabetes by itself is huge and can take hours, but broadly we divide it into, I usually tend to explain my patients that we divide it into 3 sections and each one of them is equally important. So the first thing is glucose monitoring. So glucose monitoring it can be done with finger stick glucose and then continuous glucose monitors, which we'll talk about in a minute. And then lifestyle modification with diet management and physical activity, and then your medications, which includes oral medications, injectables, and insulins. So glucose monitoring, I tell my patient, is by far the most important thing in diabetes management, because if you don't know what your glucose levels are, you won't know what you're doing and your physician won't know what they have to do or how to adjust your medications. And you can monitor your glucose traditionally by using the glucose monitors. Several of them are available. And you check it either depending on how unusual your diabetes is, twice a day, 3 times a day, 4 times a day. And then now we have continuous glucose monitors, which are gadgets that can monitor your glucose continuously 24/7. And that is really becoming the standard of care for glucose monitoring, because you don't have to prick your fingers, there's no needles in these. So as you can see on the arm, there's like a little button kind of thing that gets stuck to your arm. There is no needle inside it. It's very easy to wear. It stays there for about 14 days, and it can record your blood sugars 24/7. And it comes with a reader, which you just have to scan it, or take it close to that little sensor, and you can get your glucose number. And then you can also download an app on your phone. For most people, don't even use the reader, because you can download an app on your phone and use it. Take your phone close to the sensor and you'll get your readings. And then when you go to your doctor's office, they can download the entire graph for 14 days and get a lot more information. Also, these sensors, you can set up alarms for low blood sugars or high blood sugars. So it will alarm when you're going low or high, and that way, you'll keep being informed. If you are running too high, you know you have to cut back on whatever you're eating. Or overnight, a lot of people are worried about getting hypoglycemia or low blood sugars. But with the alarms, it really gives you a peace of mind, because it will wake you up if you go low. So you won't be worried about taking your insulin or the medications that you're taking. Besides that, monitoring also requires checking regular labs on certain things. So we need to keep a check on certain things when you're on diabetes medications or even just for diabetes. So hemoglobin A1C is the test that gives you an average glucose, your average glucose in past 3 months, and that's like a standard test we do in diabetes. So that should be checked every 3 months, especially for people who have uncontrolled diabetes. Then creatinine is another test. It's a measure of kidney function, so checking on your kidneys. And then fasting glucose levels. These usually are done routinely every 3 months. And then there are some tests that are done annually, which would include urine microalbumin test. And this is a test that basically, can you hear me?
Yes.
Okay. This is a test that tells you how much protein you're leaking in your urine, and which reflects kidney damage. So that test is usually done once a year. Then your cholesterol levels, your lipid profile, it's important to measure that once a year. Getting a diabetic eye exam and a foot exam once a year it's recommended. In terms of diet management, so there is no such thing as standard diabetic diet, because nutritional requirements in people with diabetes can vary from person to person. And the best diet plan, I tell my patients, is the one that you choose for yourself, because you know what you like to eat and you know what you're capable of doing. So having a balanced plate is what you need, and you have to create your own balanced plate. And so basically, when you look at the plate, in general, whenever you eat, you divide your plate into 4 parts, and half of your plate should come from fresh vegetables, and then 1/2 should come from the carbs, the other half should come from the proteins, and there should be very little fat in it. And that's an easy way, without without doing any carb counting. Of course, carb counting works good, but even if you don't count carbs or don't do anything, that's an easy way to have a balanced weight. Things to keep in mind when you're making a diet plan for yourself, especially if you have diabetes, is the amount of carbs. Not only amount of carbs, but total number of calories that you're eating. Portion sizing, so obviously we want you to have smaller portions. Eat till you feel not hungry, don't eat till you feel full. And then develop a habit of reading nutrition labels. Almost anything you buy or purchase when you're doing in the grocery stores, they have nutrition labels. If you develop a habit of turning the package around and look at the nutrition labels and look at the carb content and the total calorie content, it will really help you avoid some of the high calorie stuff and high carb stuff. Avoid skipping meals. This especially goes for people who are on diabetes medications. A lot of people, when they're uncontrolled diabetes, they tend to skip meals thinking their glucose will go down. This actually raises their glucose high because they'll skip one meal, then they'll get super hungry and they'll end up eating more and will end up having a much higher blood sugar. So not good for them. The biggest meal should be in the morning and the smallest meal should be in the evening. We all do, I think, exact opposite of this. Usually our breakfast is the smallest and the dinner is the biggest. But your insulin sensitivity is best in the morning. So if you are having a big meal in the morning, the body is able to absorb that and use that as energy in a much better way than if you have a huge meal at night. Physical activity is equally important. Staying physically active in diabetes management is like a major part of it. And staying physically active doesn't necessarily mean going to gym and working out on a machine. If you do that, that's excellent. If you can find time to do that. But even if you can do that, or on top of what you're doing in gym, there are many ways of staying physically active, such as walking, taking stairs instead of elevators, make parking far away in the parking lot, things doing like lawn mowing or snow shoveling, standing frequently over sitting. So there's a lot of research that people who have table jobs or who are just sitting all day, even if you stand for a few minutes every hour and do your work like standing, even if you're working on a computer, that adds to some physical activity. And then moving around during, like if you're watching TV, move around during commercial breaks. If you're talking on the phone, you can move around and walk and talk. My husband makes fun of me when I do that, but that helps. In terms of medications, so this is the list of medications. I don't expect you to read this, and I will not be able to go over everything. But if you go back about 15 years, I had about 3 medications here and insulin. I had 4 things to list on this sheet. And in last 15 years, we've made so much progress in diabetes treatment that now I have this 12 classes of medications and a zillion of them are listed on the sheet. So it's really, diabetes management has changed in the last decade or two. So much so, and we have medications that don't only lower your blood glucose, but it helps us prevent heart disease and kidney disease and other complications. So I just want to highlight a few points in terms of medications. So metformin is one of the oldest medications that we have always used for diabetes management. A lot of you must be familiar with it. It is still the best medication. We don't have anything like metformin, and we have never had it. It reduces insulin resistance and decreases the risk of complications. The reason I bring this up here is because a lot of people, when you have kidney damage from diabetes, after your kidney function is, let's say, about less than 40%, we usually stop metformin because then it's more likely to make the kidney function worse. A lot of people think that metformin causes kidney damage, and when we prescribe them, they don't want to take it because they've heard that metformin causes kidney damage. Metformin does not cause kidney damage. It's only when you already have kidney damage from diabetes or other reasons, that's when at a certain level we can give it. So don't deprive yourself of a really, really good medicine that you can use. Secondly is the GLP group. The GLP hormone is another hormone like insulin that's naturally made in your body. It's produced in your intestine in response to food. And it not only lowers glucose, but it also protects your heart, reverses the pancreatic cell damage that has occurred, and it helps you lose weight. It is one of the best medicines that we have now for treatment of diabetes. And this is about 15 years, but recently a lot of new GLPs have come out. It's an injectable medication, and you can take it. There are once a week injections like Victoza, and then there are others like Ozempic, Mounjaro, Trulicity, Bydureon, which are one you can take just once a week. So that's by itself a great thing that you just have to take the injection once a week. And Mounjaro is the newest one, and actually Mounjaro is currently being studied just for weight loss, and preliminary studies have shown that Mounjaro actually gives you weight loss equivalent to bariatric surgery. So people will not have to go for bariatric surgery after Mounjaro is approved for weight loss. And then the other class is the SGLT2 class, which is another drug that works through the kidneys. And the best one in this class is Farxiga, which again not only lowers glucose, lowers blood pressure, helps lose weight, and prevents kidney damage. And this is the only drug we have that actually prevents kidney damage in both in people with diabetes and those who don't have diabetes. We have never had a drug like this. So if you have diabetes and you're not on it, do talk to your doctor about it or ask them. So complications of diabetes, there are acute and chronic complications. Acute means complications that happen suddenly and have to be taken care of. There are medical emergencies and have to be taken care of right away. And so it can be hyperglycemia, which means really high sugar, hypoglycemia, low sugar, and diabetic ketoacidosis or DK, which is a condition where you don't only have high sugars, but you can have electrolyte imbalance, and it has to be managed in the hospital. Chronic complications develop over time and can lead to heart issues, stroke, blindness, kidney failure, circulation problems in your extremities leading to foot amputations or hearing loss. Women with diabetes are also high risk for getting problems getting pregnant and problems during pregnancy, and including problems for the baby, and repeated urinary tract and vaginal infections. Hypoglycemia is one of the most common acute complications that people have, and there's always usually a reason for it. Either you have had delayed meal or less activity or too much medication. So when you get a hypoglycemic reaction, always take a step back and think what went wrong and why you had it. For management of hypoglycemia, again, when you get hypoglycemia, the symptoms are so bad that you want to just have whatever is in front of you and just have maybe 2 glasses of juices, but then you end up having a really high sugar. So we recommend a rule of 15 for that. When you get low, when you feel low, check your blood sugars, take 15 grams of glucose at a time, wait for 15 minutes and check again, and this way you don't overshoot. Some of the things, examples of 15 grams of glucose would be glucose tablet. I recommend all my patients to keep them in their cars, in their wallets, because it's easier to carry, and it works really fast, because when you're low, you really want to take something that works really fast. And 3 tablets, each tablet is 5 grams, so you have to take 3 tablets. When you have hypoglycemia, that will make 15 grams. Then there's glucose gel. You can use hard candy, juices, and soda to bring the glucose up in your blood. Now, things like milk, chocolate, sandwiches, crackers are not good choices when your glucose is low, as they won't work as fast as you need them to work. Other chronic complications of diabetes develop gradually, and they are due to the damage to your blood vessels from high blood glucose. When the blood vessels are damaged, the blood supply to these organs is decreased, resulting in damage to these organs. Now, when you have high blood pressure and high cholesterol, it damages the blood vessels exactly in the same way. And that is the reason why we always monitor your blood pressure and your cholesterol when we are managing your diabetes. Because imagine, if you have all 3, what would happen? All 3 of them are now collectively damaging your blood vessels. And that considerably increases your risk of diabetes. How does diabetes affect women differently than men? In diabetes, compared to men, women with diabetes have a much higher risk for heart disease, and once they have a heart attack, the survival rates are much less compared to men, and also they have a higher risk for blindness and depression. Menstrual cycle and menopause, our hormone cycle can change our response to insulin too. Women with diabetes can experience decreased insulin sensitivity in the luteal phase, which is the phase that occurs right before your menses starts. And so you may see a variation in your blood glucose, usually high blood glucose prior to having your menstrual period. Similarly, menopause is another time where shifting of hormones occurs, and during this time, people may see higher blood glucose levels. The risk for diabetes also increases around the time of menopause. And I wouldn't be fair if I don't talk about diabetes and mental health. The rate of depression is extraordinarily high in women with diabetes compared to men. Diabetes distress is a condition of a feeling overwhelmed with the stress of managing the disease, fear and burnout related to diabetes, and it is much more common in women, and we understand because we are always multitasking and taking care of a zillion things together. So we often put ourselves at our own health at the back burner. So I would say don't ignore your feelings, talk with your healthcare provider, get help, get medications, get therapy. Involve your family and friends and accept their help. If they're willing to help you, take one thing at a time and take time out to enjoy yourself. So just to summarize, diabetes is an extremely common condition in South Asian females. Lifestyle modification can help prevent type 2 diabetes and control both type 1 and type 2 diabetes. There's lots of good medications out there, so discuss with your doctors and make use of them. Complications are preventable, and diabetes behave differently in women. Cyclic changes can have a significant impact on blood glucose. There's a strong association between diabetes and depression. Don't hesitate to seek help. I thank you all for listening to me.